Hello everyone. First of all, I would like to thank ABR Productions and American Telugu Association for making this program possible to worldwide people aware of what sudden cardiac death is and how to prevent this sudden cardiac death, especially in younger individuals who are every day dying of this problem with a sudden cardiac death. Yeah. Now I would like to introduce Dr. Prasad Garimella, who is a well-known pulmonologist and a critical care and a sleep medicine specialist, and also past chief of medicine at Northside Hospital, to talk about what the life support, how we can learn the CPR, and how we can make the life prolonged and save from the sudden cardiac death in these high-risk patients.
Thank you, Dr. Gangasani, for the wonderful introduction. Thanks to American Telugu Association and ABR Productions. I'm Prasad Garimella. I'm a pulmonary critical care and sleep medicine specialist. So today's talk, I want to talk about the CPR, BLS. CPR is cardiopulmonary resuscitation. It's same thing as BLS or basic life support. What is CPR, why we need to do it, how we need to do it, who we need to do it is what we're going to discuss today. Before we go to the CPR, let's see what happens when the patient needs the CPR. The heart, the lungs, and the brain, those work in parallel to maintain the life. So if the heart is not working, you are not going to have the pulse. If the lungs are not going to work, if they are not working, the breath, they will have shortness of breath or they are not breathing. If the brain is not working, they are unresponsive. So CPR, a simple way to remember what to do is instead of panic, instead of fear, you need to do ACT. ACT is the mnemonic, easy to remember. A, C, and T. A stands for assessment, C stands for call, T stands for treat. So let's go through these three things. Number one, A. We already talked about these three organs. So when you're trying to assess the patient whether they need the CPR or not, you are assessing the brain, the heart, and the lungs. So for the brain, if the patient is unresponsive, you're going to test whether the patient is responsive or not. So if this patient is unresponsive, you're going to test that. You tap on their shoulder above the clavicle and ask, "Are you okay?" If they don't respond or they are in distress, you need to consider doing the chest compressions if there is no pulse. So that is assessing the brain function. Next, you are going to check for the pulse. In adults, you check the carotid pulse. So how do you know where the carotid is? So you feel the windpipe. The windpipe is in front of the neck. So to the side of the windpipe, you can feel the pulse. That's the carotid artery. That's where you feel the pulse. Then you listen and see if they are breathing or not. So that's how you assess the brain, heart, and the lungs. If the patient is not having the pulse, if they are not responsive, and if they are not breathing, that means that they need CPR or BLS. The assessment should take only less than 10 seconds. You don't want to spend a lot of time assessing the patient. Next, we are going to move to C. C for call. So if you assess the patient and the patient needs help, immediately ask for help. So if you are in the hospital, you call for code blue. If you are outside, you ask for help, nearby person. And not only asking them for help, you also tell them at the same time if there is a defibrillator to bring the defibrillator. If nobody is there, or you can ask somebody to call emergency response team. So that is C. So it's very important, depending on the situation, you immediately call for help and also request for defibrillator, or take your own phone and call the emergency response system. That is very important before you start treating the patient. So the third aspect is treat. So treat involves assessing 4 things. One is obviously chest compressions. Number 2 is defibrillation. Number 3 is airway. Number 4 is breathing. These are the 4 things you need to assess to support the cardiopulmonary system so that the blood is continuing to the brain. Chest compressions. So where do you place the hand? How much you do, how fast you do is all you need to know. So in an adult patient, you need to find the breastbone or the sternum. So the bottom portion of the breastbone is called the xiphoid process. So one way you feel is like you follow the ribs, the bottom portion of the ribs, and then in the center, just above that, is the xiphoid process. The other thing is to follow the nipple line. If they are not obese, you can follow the nipple line, and in the center, you put the palm of your hand and you lock it. And then make sure that your hand, elbows, and shoulder are straight. And you do the chest compressions. So the important thing is to give 100 to 120 beats per minute. So that is the critical part. So by doing those chest compressions, you are pumping the heart that is not working. So that way you are establishing the circulation going to the rest of the body. How deep you do? In adults, you do at least 2 inches. Effective cardiopulmonary resuscitation is what is going to save the patient, and that is why very important to learn the skill, and you could save someone's life in danger. So we talked about where you place it, how you place it, how deep you do it too, and the most important thing is to let recoil. So if you do not let that recoil to occur, the heart is not filling up with the blood again. So that's why it is very important that you do the chest compressions and let go, and then do the chest compressions again. So when you do it 100 to 120 times per minute, that is the rate that you do, that's the depth that you need to do. So that's about the chest compressions. Next step you need to know is defibrillator. So the defibrillation, like Dr. Gangasani was saying earlier, sudden cardiac death, if the patient has ventricular fibrillation, one of the most common causes for sudden cardiac death, you need to shock the patient. So by shocking the patient, you're bringing them back into the rhythm. So the defibrillators are available in public places, especially airports and other places. So once the defibrillator is available, you switch it on first, and then you put the pads on the patient. There are 2 pads. You pass one in the right side, front, and then one on the side. So the point is, between these 2 pads, the electricity is conducted, so that electricity is going through the heart, so to re-establish a stable rhythm of the heart. So the placement of them, the switching it on so that you are not wasting time, and you need to analyze. Once you press that analyze button, you do not do the chest compressions. So that, by doing the chest compressions, you are going to create some rhythm, some electricity. So you do not touch the patient, you analyze, and if it is a shockable rhythm, the defibrillator will give a audio prompt. If the shock is required, it is going to ask you to shock the patient. At that time, you charge and then shock. Before you do that, press the button to give the shock to the patient. You need to clear and make sure that everything is safe. Everybody is safe. So, and then once that shock is delivered, then you resume the chest compressions. So that is defibrillation. So this is an important life-giving skill, life-saving skill that everybody will be proud of for having that learned, mastered. That's number 2 is the defibrillation. The third aspect is the airway, especially in restaurants or children, it could be a choking. The airway is basically It starts in the nose and the mouth. The air is following back of the nose, back of the throat, and then going through the windpipe into the lungs. If there is any blockage to the airway, the air in the atmosphere is not reaching the lungs. So it is very important to establish the airway. So simple things are, you make sure if they are not breathing well, do a chin lift. So you push on the chin so that the trachea or the windpipe is going to be straightened. Then the other thing, if there is a neck injury suspected, you do the jaw thrust. So by the side of the jaw, lower jaw or mandible, you push the lower jaw or mandible forward. So that way you establish the airway. So the other scenario that you could encounter is a choking victim. Choking victim, somebody swallowed while eating, the food particle has entered the wrong pipe. So there's a food pipe in the back, there's a windpipe in the front. If the food is going into the wrong side, into the front, into the windpipe, so they suddenly don't have any air reaching the lung, obviously that's going to shut down the cardiopulmonary system. So you need to consider doing Heimlich maneuver in those patients. In an adult patient, you do the Heimlich maneuver by putting your locked wrists from behind, and then give the compression, chest compression. By doing those chest compressions, you are creating that positive pressure which will dislodge that foreign body from the food particle or the foreign body from the windpipe. That's how you can immediately save. So Dr. Heimlich, who invented this many years ago, and when he was at 97 years of age, he happened to have a person in the restaurant, and he saved somebody at 97. So that's called the Heimlich maneuver, and that's for the adults. For children, infants and neonates, those maneuvers to dislodge the foreign body are different. That's why I strongly recommend that all of you take a certification in basic life support. It is as important as you drive and get a driver's license. And finally, last one is the ventilation. In this COVID pandemic era, it is not advisable to do the mouth-to-mouth breathing, but if you have an advanced airway, or if you have a mask, a face mask or non-rebreather mask that you can provide safely with oxygen source, you should give 2 breaths for every 30 chest compressions. So that's the ratio that you follow. You don't want to give too much of ventilation because that has its own downside to a patient who is already critical. These are the 4 things that you assess in the treat. So the victim, the person who needs the CPR, could be a neonate. Neonate is first from birth to 4 weeks, 28 days. Infant is from 28 days of age to 1 year is infant. A child is 1 year to puberty. And from puberty to 18 years of age is adolescent. And then after 18 is obviously adult. So the CPR is different for different ages. Obviously, the needs are different. The rates with which you give the support are going to be different. That is why it is essential for people to know the basic life support certification. Another important thing you need to know is when to stop the chest compressions. If the patient has recovery, the goal of CPR is spontaneous return of circulation. How do you know that patient has spontaneous circulation? Is by feeling the pulse. So if the patient has a pulse, or he has responsiveness, or he started to move, or he started to breathe, or by advanced CO2 monitoring and other devices, you can measure whether the patient has spontaneous return of circulation or not. So if the patient has spontaneous return of circulation, or a medical professional physician has asked to stop the chest compressions until that time it is recommended to continue the CPR. So the goals of CPR are that it is safe, number one. Number two is it is effective. And number three is spontaneous return of circulation. So it has to be safe for you, for the patient, and people around you. You don't want to do the chest compressions in a busy road. You got to move the patient to a place where it is safe for you and for him. You want to make sure patient is not wet in the front before you put on the defibrillation and give the shocks. These are safety features you need to think about. The another, with the pandemic, it is very important that you consider the possible COVID status of the patient. That is not discouraging you to do the chest compressions, but take all the precautions possible to save a life. Effective. Effective means that you know what you are doing. Instead of paralyzed by the fear, knowledge is power. You know the knowledge of how to give the life to the patient when it is needed, and the skill that is mastered is going to save the patient. Every minute that is lost is going to decrease the chance of survival by 10%. I want to reiterate what Dr. Gangasani mentioned earlier about this. Time is so crucial here. And the third one is spontaneous return of circulation is the third goal of CPR or basic life support. There are many areas, colleges, the heart associations, medical associations who are providing this excellent certification. So like I said earlier, it is as important as you have a driver's license to have a BLS. You could save lives. And don't forget ACT, assess, call, and treat. Go save lives. Thank you.